Hello, so this video is COVID versus the USA. Why is the America's death toll so high? So, thanks for watching.
Crazy.
Oh, that's what it is?
Oh. He just took out a syringe and he made a shot with heroin.
I've been waiting for the moment of complete and total societal collapse my whole life. I never knew it would happen this way.
New York alone has become a place of dozens and dozens of demonstrations. We're driving through Brownsville, one of New York's neighborhoods that has the worst homicide and shooting rate in the city.
Oh yeah, you know,
I'm about to get going. Oh my God, this is...
That's a deceased, yeah. Do I think we're going to get a second wave? I said, we're not even done with the first wave.
Hold on. No, you can't be filming like that.
It's a mess what's going on behind those walls.
The richest country, most powerful, and yeah, it has the worst response. There's third world countries that are doing much better.
We're screwed. We're doing nothing about it.
The level of deaths are going to be so great, the dead, that we're going to have to bury them maybe in parks, maybe in Potter's Field.
This truly has become a grim symbol of the current pandemic in New York. This is the Vietnam Veterans Memorial. It honors those Americans who fought and died in that war more than 4 decades ago. Their names are inscribed on the black granite wall in memory of that national tragedy which claimed 58,000 lives of U.S. men and women in uniform. Over the last couple of months, COVID-19 has killed almost 150,000 people in the U.S. It's 3 times more lives than the Vietnam War took in its entire 10 years. It's a different kind of enemy now, but this is a war, and America's losing it pretty badly. Something has gone wrong, and we came here to find out what. We'll take a look at how the coronavirus has ripped through America's healthcare and economy, and what it means for the rest of the world. So, buckle up. The New York of 2020 will probably be featured in history books. The city is nothing like it used to be. Ever-humming downtown streets deserted. Those who can, isolate themselves at home. Those who can't, wear masks or protective face wraps as if the virus is in every breath of air. And all of this somehow concurrent with endless demonstrations and protests happening left and right.
Government can't kiss my
What do we need to get out of this mess?
revolution, nothing less.
New York alone has become a place of dozens and dozens of demonstrations that are taking place all at once. Today, on a Saturday, I counted 30 different events related to the Black Lives Matter movement. And people protest about so many things: inequality, police brutality, racial profiling, black lives, Latino lives, trans lives, you name it. These people, for example, are protesting against Trump and the federal agents that he's sending to cities in response to soaring crime rates.
Trump, Pence, out now!
Trump, Pence, out now!
It's been a very crazy couple months. It's amazing how short amount of time it's been. It was like March, all of a sudden we had to figure out and everybody had to work from home and get toilet paper. And that became a highly valued thing. April, May, we were getting used to it, and then boom, George Floyd is murdered. Multiple other police injustices against people of color are brought to the forefront, and it's just really lit up.
Now, COVID's over here. Then we had looting. Have you been downtown? Have you been to 57th Street, Fifth Avenue, Madison Avenue? $1 million plus, these incredible fashion houses, boarded up, plywooded, gone. Then came the riots, organized riots, pallets of bricks. I have been waiting for the moment of complete and total societal collapse my whole life. I never knew it would happen this way. The country was held together by the slimmest of glue, societal glue, and this just broke it apart.
Look at this. One of their main slogans is, how do we get out of this mess? Revolution, nothing less. I mean, really, the revolution? I guess this is the last missing piece for this country. Are you concerned at all about social distancing? I mean, people obviously is not 6 feet away with each other.
And we're yelling, and we're aware of that. And so one of the things, I actually brought extra PPE for people. We don't want any reason for anybody, and actually hand sanitizer. We don't want anyone for any reason to be potentially causing risk to the people around us. But for the good of humanity, we need to be out here.
Nobody is even questioning the horror of the death of George Floyd. But I defy anybody to explain to you what's Black Lives Matter. And the number of people, white Americans, suburban, high income, who have their Black Lives Matter, they have their Black Lives Matter sign in the front yard, they got their gay flag here, they've got it all covered. They've got it all covered. And they couldn't tell you. It's become almost like in some cases, an article of clothing, a boutonniere. It's a style.
Black women lives matter. Black men lives matter.
Black men lives matter.
Is it really what it is? You're selling why on earth?
Okay, so the whole point of these ashtrays are to edify and to bring more light to the in general. People don't speak about enough, and so there's not a lot of people that are educated on it.
If you don't know what we mean by Gestapo, can't even protest.
When you think you've seen it all.
Do we want to end up
Crazy.
in a place where we can't even...
But how did it all begin? How did the USA end up in such a situation?
What would be a proper greeting this time? Just elbow right there. Sure. Yeah, thank you. Something we should get used to nowadays.
We have to get used to it. And, yeah.
Derek, he works as a nurse in one of New York's hospitals, right?
Yes.
And he also was a vocal critic of the way this whole pandemic and crisis was handled in New York and in the country. Do you think that New York was prepared for this outbreak?
Honestly, I don't feel like we were prepared very much at all. I think a quicker shutdown would have done a bit better to mitigate the spread that was going on.
Part of the reason the virus has spread so much is that so many people live in big cities like New York with minimal or no access to proper health care. These are the homeless and poor, people who don't have good insurance plans.
So this is going to be our first shooting location, a small park in Manhattan where volunteers are distributing food for homeless and poor. Statistics show that homeless people are dying from COVID-19 at a rate 61% higher than the general population in New York. And public shelters, where most of them live, are notorious for being coronavirus hotbeds. So we're going to look around and talk to these people to find out what this pandemic is like for them. I've heard that they have they give away food here, like every Monday and Wednesday.
They shoot a lot of heroin too here.
No kidding.
Yeah, no kidding.
So how this pandemic's been going on for you personally? How are you holding up?
I'm gonna be quite honest with you. I think it's all a bunch of
How so?
How so?
I mean, people are dying.
People are dying, but it's more to it than that, man.
You don't believe in you don't believe in COVID, that this is a real threat, that this is something for real.
I don't think it's a threat towards everybody, is my point. Yeah. It's not a threat towards me. Oh, that's what it is? Oh, mean I won't get it. I got gross, man. It's just I have a hard time sometimes.
Right, tell him. Explain to him.
I don't know, this is crazy. This is crazy. This is crazy. I can't believe this is happening.
We're screwed. We're doing nothing about it. We take no precautions.
I saw you guys not wearing a mask, so I got a bunch of them.
Thank you so much. But yeah, that's the root of it all, man. Like, I just know that I've been out here and being homeless.
Like, literally, this is so crazy. I'm not kidding, this is the first man I interviewed in New York when I get here. And this guy literally, he just took out a syringe and he made a shot with heroin. I mean, this is crazy. And it's just, you know, I'm not comfortable with that. It's over the top. It is scary. These people, they do not believe in COVID. They frankly don't care. Maybe poverty isn't the main reason coronavirus has spread in the US, but you know, it's definitely contributed to making the numbers look bad.
Especially in New York City, we have a lot of unhoused people who don't have access to clean water, antibacterials, hand sanitizer. Even the ability to socially distance is a luxury for them, right? So without that ability, first of all, it's horrible, but second of all, it breeds the possibility of contagion going forward.
What was this pandemic like for you?
Oh, like everybody else. I definitely didn't expect anything like this to surface, you know what I'm saying? Out of nowhere.
Yeah, I mean, do you have a plan? Like, for example, if tomorrow you feel any symptoms, like, what would you do? You go to a hospital, you have insurance, like, do you have a plan?
I don't know, go to the hospital, see what's up.
Maybe you know some folks who are staying in a shelter or something like that.
I guess Bellevue would be your first one. You
know
Bellevue's at? On 26th and 1st Avenue.
This part of Manhattan?
That's it, right there. Right there, yeah.
All right, so these guys directed us to one of the largest shelters in Manhattan, and there's been a lot of reports that these facilities are overcrowded, and the people there, well, they have been left to cope with COVID on their own. So this is the place, the shelter we were told about. It's getting late, so people are coming in, and Bellevue Homeless Shelter, it's the name, was all over the news just recently when terrible pictures of men sleeping on the floor, inches apart, went viral. This is definitely not the way you contain the spread of coronavirus in a city. And here's what happened. After the public outcry about homeless people crowding New York subways, city authorities came after them and forced them into these public shelters. The problem is that the facilities were quickly overcrowded. There are not enough beds, not enough PPE, men sleep on top of each other. It's a mess what's going on behind those walls. So you have around 20 shelters across the city at the height of the pandemic, which are nothing but COVID hotbeds.
Well, hold on.
Yes, sir.
Can I help you with something?
No, I just wanted to...
No, you can't be filming like that.
Okay, all right, sorry.
We are not allowed to go inside without permission, plus there are probably people who are infected right now, and we don't want to risk it. So, but we might find someone outside who would be willing to talk. I've seen a lot of reports that, you know, at the height of the pandemic, it was overcrowded. People were sleeping on top of each other.
Yeah.
Was that right?
There was people, you know, in the same room. It's supposed to be 6 feet away. And they had about like 10 people in one room. If it was a 4-man, they leave 4 people in there. You know, it was an epidemic in this.
Not a social distancing,
Not a
right?
social distancing.
What do you think about this whole COVID thing?
I mean, this whole COVID thing is, I guess, fuck a lower population. Why not?
So what's your plan for tonight?
My plan for tonight is to sleep in the grass.
You already got a spot?
Yeah, I got a spot over there.
Can you show us to it?
All right, no problem. I'll show you.
Let's go.
All right. I just sleep.
You're not scared? Like, I mean,
it's not about being scared. It's about being homeless. You got to take it how it is. Because my family, they give me $2 or $3 there and there, but they don't really want to help me.
it's just, it's the microcosm of this COVID-19 crisis in New York. If you look at this from these guys' perspective, he doesn't care. He's gonna sleep outside tonight. He doesn't wear a mask. He doesn't obey or follow any social distancing. This guy probably has COVID. He might be not aware of that. And it's just the way it goes.
There are people in this city who are insane. They're not homeless. Yes, they are homeless because they're insane. They're also toothless and shoeless and jobless and sometimes hopeless. And whatever you want to call it, insanity, drug addiction, alcohol addiction, combinations thereof, I don't know. I am seeing a level of insanity on the street that I've never seen. And I'm used to a lot of stuff. I've seen things that you wouldn't believe.
It's not just homeless and poor falling victim to the COVID crisis in the U.S. And there is one place, not far from New York, that reveals the unprecedented scale of the catastrophe.
This place is called Hart Island. It's about an hour ride from New York and a 15 minutes boat ride from the nearest dock. If a body can be identified or if a person has no family or a family could not afford burial costs, then Hart Island is the answer. It has been serving as a mass grave for centuries, but now with all this pandemic, this place is in high demand. Gruesome aerial footage shown unclaimed bodies being buried in trenches here.
Rumor has it that when it blows northeast with the northeast storm, all the rocks on the northeast side of the island here were placed for the erosion of the dirt. They say bones will wash up onto the island and things like that, following the current the next day, following days. I've heard some people say that there's some old city islanders who have skulls or things like that. It's kind of creepy, yeah.
I think this is as close as we can get. You actually are not allowed to set foot on the island. Well, I mean, now, when it's so quiet, you're really getting goosebumps. I mean, this is the largest mass grave in the United States, and, you know, how many bodies are out there? This truly has become a grim symbol of the current pandemic in New York.
This is what we woke to one morning. The level of deaths are going to be so great, the dead, that we're going to have to bury them maybe in parks, maybe in Potter's Field, maybe, but we're going to have to, we won't be able to handle this. They had next to hospitals, trailers, tractor trailers, refrigerated to handle the overflow of the dead. It went crazy.
Nice to meet you. How are you doing? Diana is a nurse at one of New York hospitals, and she's been a vocal critic of the way this pandemic was handled since day one.
We are definitely walking into a war zone, and we no longer know what we're walking into. We don't know who has this virus. We don't know who's been exposed.
Diana, you took part in numerous demonstrations. Can you explain to us what you were protesting against?
Protective equipment.
It shouldn't have been a decision of who gets a mask and who doesn't. That's inhumane. Everybody in healthcare, if we're essential, we deserve masks.
They kept telling us, don't use the masks because you don't need it and we don't want to waste them. I don't know.
I mean, the management of the hospital you're working in was telling you that you should not wearing a mask.
We don't want to see people wearing masks because we don't want to waste them. We didn't have enough masks. We had no gowns. We had...
This just sounds crazy to me. How is that even possible that you didn't have any of that?
So what happened was, we had some, but we never have so many people in isolation that you would run out. So we would have 1, 2 isolations in a unit, in a single unit at a given time. Now we're talking about hundreds of people. We quickly ran out because they didn't anticipate what it would be like or how much they would need. And of course, they're thinking about cost. So am I gonna buy hundreds and hundreds of masks and not knowing how many I'm gonna need?
It's not the matter of money, right? Because money is there. The United States is the richest country on earth. It still is, and it spends the most on its people per capita.
The money went to the wrong people or the wrong places, right? The billionaires made the most money during the pandemic, and the poor people still struggle. They were worried about big corporations. You're worried about big corporations. There might not be workers to work and run it afterwards because the CEO is gonna make it, but he's not the one doing the work.
I've seen reports in local press in New York that some nurses, they had to put on these trash bags as a protective equipment.
I mean, the picture is real. It really did happen. They did really put that on because, like I said, we ran out. People were hanging their gowns from the door. So, okay, this gown is dirty. I can't leave the room with it, but I'm gonna have to hang it in the door because when I come back in, and I have to come back in, I'm not gonna have another gown. Those masks, gowns, gloves, it was never meant to stay on, and it was never made to use it once over and over again. You don't bring soldiers to war and you don't give them weapons and you tell them, yeah, go out there and good luck, try to figure it out. Hopefully you can kill the enemy if you trip him and take his weapon and then you should be okay. The police, they have good gear when they go out there and throw gases at people. They have good gear, they have good masks. They have the masks that we should have been using. Nobody helped us. It was our own fight. We had to fight for everything.
We asked the hospital what they had to say about these allegations, but unfortunately, they refused to give us a proper interview. Instead, they sent a standard reply that says, quote, "We are continuing to move heaven and earth to ensure our healthcare workers have access to proper PPE," adding that the system was operating at the high capacity and at the greatest humanitarian crisis in the century. End quote.
The richest country, most powerful, and yeah, it has the worst response. There's third world countries that are doing much better. China did so much better than us. You can't explain this, and there's no excuse. Because we had the resources, the money, the intelligence. We have some of the best doctors, scientists, everything here, and yet we still couldn't get it together.
We thought we should also visit another state, Florida, because it has become a new coronavirus hotspot in the U.S. Over the last 7 days, 73,000 new cases have been registered there, more than in any other state. At the moment, there are over 400,000 confirmed COVID-19 cases in Florida, and it's twice as many as New York has had, and 5 times more than the whole of China has experienced since the beginning of the pandemic. So if New York used to be America's COVID-19 epicenter, now it seems to have shifted to Florida, and we're going to cross its state line any minute now. All right, Tomas? Yeah, nice to meet you. Nice to meet you. Tomas is an activist here in Florida who raises public awareness about the COVID-19 situation, and he also became the center of attention a few weeks back when he interrupted the governor's press conference.
You're an embarrassment. We're getting record-breaking cases every day, and you are doing nothing. You are falsifying information, and you are misleading the public. Over 4,000 people have died, and you are blaming the protesters. You guys have no plan, and you're doing nothing. Shame on you.
So, Tomas, what actually prompted you to do this?
The state of Florida is now a disaster, right? We're getting record cases every day. Yesterday we had record number of deaths, I believe 186 deaths. Today we had 217, and we have more cases than New York and Italy, which were initial epicenters for this pandemic, and we are 4 or 5 months out from the start. And it's frankly because the governor refuses to do basic things like instituting a statewide mask mandate, refuses to listen to public health experts.
So here's a little bit of backstory about Florida that shows what a wavering approach to COVID can do. When big states like California and New York rushed to shut down and quarantine in March, this state remained open. Much later in April, Governor Ron DeSantis reluctantly ordered bars, restaurants, gyms, and other public places closed. By May, the number of confirmed COVID cases was relatively low in Florida, so DeSantis was among the first governors to reopen his state. He even bragged about how well he had managed the outbreak and saved the local economy. And that's when things began to unravel. Cases went up, hospitals started to flood with patients, white refrigerators appeared to accommodate the bodies that the morgues couldn't handle, and Florida came into the national spotlight.
And if you remember, actually, Florida initially made news through the pandemic because spring breakers, which are young college people and young people that come to this part of South Florida to party in March because they have a break in school, the county and the state government and the county government didn't do anything to try to stop that because it's money, right? And we're seeing it now. Disney World reopened in the middle of a pandemic, right? So if you ask me, it's really just greed and the fact that these people want to make money no matter what.
By the way, let's just also explain to the audience that we actually have to keep our masks on throughout this interview, even though we are outside.
In this county, just this county, Miami-Dade, there's an ordinance that was set up in place about 2 weeks ago or so that mandates mask wearing under the threat of a fine, right? This mask mandate, remember, happened about 2 weeks ago, so very, very late into the crisis. I don't think that throughout the whole of Florida, they're really taking this seriously.
You want to know how I feel about the mask? It doesn't stop the virus. You're going to catch it with the mask on and with it off. You know, yeah. I mean, see, when you're wearing the mask, your body is not releasing, you know, the particles and stuff in your body, you know, and you're not getting fresh air with the mask on. So, and I mean, and you can still catch it with the mask on.
I feel like you're gonna get sicker wearing the mask because you breathing in your own.
Yeah.
I mean, you have bad breath, you're gonna be smelling your breath all day, and it's like, it's gonna make you sick. And it's like, oh.
Yeah, so. I think it's just a scare.
Yeah.
It's all a scare. And then the election coming up. So, hey.
We'll see what happens in November.
We see what happens in November. No COVID, no nothing. Right. What COVID after November? Watch. Everything just back to normal.
And I heard that they was putting the corona in the test swabs. I heard they was giving people corona.
Yeah.
When they was
the
testing
the COVID-19 testing. Yeah, people are going to get tested and coming back with the corona.
That's what I heard.
The contrast is dramatic. Relaxed and reckless Florida that is just about to get struck by the pandemic compared to depressed and tormented New York, which is just trying to get back on its feet after COVID's devastating blow.
This COVID crisis has devastated a lot of American businesses, but there is one sector that has been thriving since the onset of the pandemic. funeral homes. This one in Elmhurst, which is the area that has seen more coronavirus deaths than any other neighborhood in New York, has been working extra shifts since the beginning of this pandemic. So let's see the owner of this funeral home and get his perspective on all that. Hi.
Hello. How are you?
Yeah, good. I'm Konstantin.
Nice to meet you.
Nice to meet you, sir.
How are you?
Good, good.
Very first week of April. We were here one day and the phone started to ring. And every time it rang and we picked the phone up, it was a death call.
So have you ever seen anything like this before?
No. Nobody in this business has ever seen anything like this. You know, some people ask me, how do you compare this to 9/11? I says, you can't. I said, 9/11 had 3,000 people killed. So you can't even compare this to 9/11.
I've seen a lot of footage that was shot in this area with U-Haul trucks standing just right in front of funeral homes, and, you know, bodies are being carried into these trucks. I mean, that was crazy.
This is for real. This is real. This is right here in Brooklyn. This is right at Brooklyn Hospital. Y'all, this is for real. They put the bodies in 18-wheeler, y'all. Please stay inside. This is for real. My hand is shaking because it's hard to look at this right here, what I'm seeing right now.
It was an unfortunate incident in Brooklyn, you know, with a funeral home, that he was storing bodies in U-Haul trucks, and he stored too many, and he couldn't dispose of them. The bodies started to decompose, and he had a big situation. I mean, it was all over the newspapers. You can come in here and just film from the back.
Oh my God, this is...
That's the deceased, yeah. That's the one that's starting at 1 o'clock. This is Omar is finishing up, and that's Alexandra. She's getting the body, you know, she's fixing the hair and the makeup on her.
When you get to a place like this, when you have death on a daily basis, then it's a whole another story.
You know, people, oh, I don't really believe this. Trust me. I've seen it firsthand. It's real.
Do you have an explanation why has Elmhurst been hit so hard by COVID-19 compared to other parts of the city?
The only thing that comes to mind is possibly the way that people live. I mean, Elmhurst is very, very diverse. I mean, there's a lot of nationalities. You know, you have a house like this, all right? You know, it's a legal two-family, but they'll convert the basement into apartments to bring people in to help pay the rent. And then they'll crowd them in there.
Well, in America, this is especially striking. The spread of the coronavirus is directly related to the standard of living in a particular area. If it's a poor neighborhood with a lot of migrants, then the virus is going to spread far more quickly and claim more lives than in other parts of the city. So if you are in a more affluent area of New York, you might find 1 or 2 people without a mask, because if there is nothing they should worry about. But here in Elmhurst, where death is so real and so close, you'd be hard-pressed to find anyone without protection.
We're incredibly unequal in our society compared to Western, Northern Europe, etc. And when it comes to public resources, institutions, and services, we don't prioritize that here. So we're rich if you look at GDP and if you look at the fact that we have like more billionaires than other societies, but in an incredibly poor overall and an incredibly unequal country, that means that these kinds of crises are going to affect some folks much worse than it does others.
You can come in. This is a portion of the cremains that have not been picked up from the cases that we did.
Wait, hold on a second. So this...
All of these are what they call cremains. This is after somebody's been cremated.
Ashes.
It's ashes.
I'm getting goosebumps here.
So.
What's the weight of a box?
I tell people
4 kilos.
The size of weight is about a 5-pound bag of sugar. It's about that.
It's just, I'm sorry, it's just crazy. This is what left of a person.
This is what's left of you, yes.
Daniel Santa Cruz, Anthony Palermo, yeah, Eusebio Espinoza. Yeah, those are Latino names.
Yeah. Yeah, I mean, 95% of my business is minorities and first-wave immigrant folks from another country.
The most vulnerable part of the society who was hit the hardest.
I think the Mexicans.
Why does inequality in this city carry over into healthcare so much?
Because, for one, the poor people were forced to come out. It was choosing between exposing yourself and earning your living, because then you might not have money to buy food. Poor people have less resources, therefore they probably are not as healthy. Poor people don't have luxury per se, or the luxury of saying, I'm gonna isolate myself.
I could swear I did. I don't know. I don't know anymore, Joe.
You got business to do.
I do. You want your microphone back?
There's conventional wisdom that if you want to do something right, give it to the private sector. Yeah. We have the largest healthcare system in the world, in the US, which is private or semi-private, we should say, right? Sure. So from that perspective, it should be doing just fine.
Well, as we've seen, it's not. You need only look at the current system and see what's taking place. It's far from adequate. You have people that are stacking on medical debt now from their COVID treatments, let alone everything else. Kind of a one man for themselves, price gouging, no limitations, cost barrier, thing that results in what we're dealing with now, and why I believe one of the biggest reasons for bankruptcy for average citizens these days are from medical debt.
Hi guys, my name is Janet Mendez. I've been in the hospital maybe almost a month.
Before we jump into this interview, I'm just gonna quickly explain Janet's story here. So she contracted COVID, she recovered, but then she was hit with this ridiculous $400,000 medical bill.
So Ms. Mendez, today is the day you're going home.
Yay.
Congratulations.
Thank you.
My mother said that I actually started getting phone calls while I was still in the hospital, and that the bill was already there before I arrived home.
Do you have the bill on you?
Yes. So this is how much I was charged, all of the stuff. The government supposedly gave me help, and the bill went down to $75,000.
So they kindly reduced the total, but it's still $75,000.
Yes. And then I started getting little bills from different departments from what happened since I got to the hospital. So I got a different bill from the ER, a different bill from the radiologist, a different bill for the cardiologist.
So it's the same hospital, and different departments within the hospital, they charge you different, like, independently?
Independently, yes. Up to now, I haven't seen the ambulance bill either, because I'm assuming since they're charging everything individually, they're gonna be also on the ambulance bill, because the ambulance took me and brought me back home. After the New York Times article, St. Luke's froze the account, saying, oh, we're gonna review how much you really owe, and we're later on gonna send you the final bill of how much you really owe the hospital. We're calculating maybe from $6,000 to $16,000 I might have left over that I have to actually pay from my pocket.
But hold on a sec, so you had an insurance by the time you went to the hospital, right?
I had insurance the whole time.
Since you had the insurance, why do you have to pay anyway?
Because out of pocket, I still have $6,000 in network out of pocket that I have to pay. That's the insurance.
I guess it calls deductible.
Yes,
right?
deductible, yes.
But anyway, why is everything so up in the air? It's just too, well, to me, this sounds really complicated.
I don't know why they're making it so complicated. And okay, you're in the hospital. They're all the same hospital. It's not like I left to a different location. It's all inside the same hospital. Why do you need to send so many different bills? So they're washing their hands by saying, oh, but I'm only in charge of this department, so I don't know what the other department is charging you. Oh, let me figure it out. Let me find out. And weeks pass by, and still nothing. It's been, how long? Almost 3 months since I've been outside of the hospital, and I don't know what's the real amount yet.
The U.S. government announced that they're going to cover all costs for COVID anyway, but you got your bill.
Yes, that's why it surprised me too.
This is confusing.
Yes, because I was watching the news in the beginning. They were like saying, oh, don't worry about it. If you contract COVID, we're paying all the bills for you, like the whole hospital bill. So why am I getting so much large amounts for the hospital for this if I got COVID? It's not for something else.
The hospital wants money in their pocket, so they're not going to tell you, oh, well, you don't have to pay for this because the government gave us money. They're going to try to squeeze it through you and see if you understand what I'm saying. The healthcare system, it's not made for the people. It's not made to keep you healthy. It's not made to help you in any way. It's certainly not made to help you pay your bills, right? It's a for-profit system.
What happens if you, for example, do not pay?
What they do is that they go to a debt collector. They'll do a settlement. They'll try to get me to pay something. If I still don't pay, or even though I do the settlement, it stays in my record for 8 years. And then if I've ever want to buy a home, buy a house, or even rent an apartment, it will affect my credit.
Bottom line, it's too dangerous to get sick here.
Yes, it is. You have to think about it if you are covered or have money always saved just for you to go to a hospital.
So it's a vicious circle. To pay the medical bills, at least in part, you need insurance. To get insurance, you need a job. But due to the pandemic, unemployment in the U.S. is rising and has already reached record levels. We're driving through Brownsville, one of New York's neighborhoods that has the worst homicide and shooting rate in the city.
Yeah, she told me I was a G. So I told her, yeah, you know who I am. Cause on the really, who else can it be? And when it comes to staying fly, ma, you know that I
Violent crimes has gone through the roof in the last couple of months across the country. In June, some 270 people were shot dead on New York streets, and it's a 154% increase from last year. Everyone talks about the murder of David Gardner, a 1-year-old boy who was shot dead at a barbecue party. I mean, if that's what barbecues look like right now, then something definitely is going wrong. Senior New York residents recall the bad old days when in the 1980s and 1970s, violent crimes were rampant and neighborhoods were no-go zones.
We're walking around Brownsville. Am I scared? Well, a little. Oh, excuse me, guys. Yeah. We were just walking around and wondering, like, what people have to say in this particular area of New York. So, if you don't mind, I will ask you a few questions, if that's good.
The whole COVID-19, it messed up New York City major because I dance in New York City in the streets.
Oh, wow,
that's cool. I've been doing it since I was 16 years old. And, but, come on, y'all. Calm down, breathe. Don't worry about the video, but anyway, like I was saying, COVID-19 kind of shut down. COVID kind of shut down New York City.
Along with COVID came the surge of violent crimes in the city.
Of course. And then the looting, which has nothing to do with nothing. People just want a reason. And the hood is just, I look for a reason to do something stupid. I got attacked, I got stabbed, they cut me from the hair down.
Wow.
I went out on mental disability. So you can't go up to any and everybody, you gotta be cautious on who you go up to and you speak to. Especially
you mean in this area?
Anywhere, especially when you're dealing with young people. Like you might want to get somebody young in a group of them and they stand there, they be smoking something, they might be on the perks or Zans or Molly or E-Pill. And they look, oh yeah, you know, acting all ignorant. But the thing is, you gotta come up to men, have a conversation with them, and men will talk to you. And with that being said,
peace out. All right, guys.
Bye.
Have a nice day.
Well, I mean, those guys were pretty nice, and they didn't look like scary at all, but they reminded us that we should not run into the wrong crowd here. So, better get going.
The US, just like the rest of the world, is fighting its war against COVID-19. It will no doubt achieve victory eventually, but the question is, at what cost?
Every aspect of living in New York has been utterly destroyed. From the guy on the corner with the hot dogs, to Wall Street, to law firms, to theater.
It's very hard to fight on with discord and unrest in your own camp. And when those who are supposed to battle on the front line are about to give up.
I just want out. Like, I don't want to be a nurse anymore. I don't want to be a healthcare worker anymore. You know, the hero. We were thrown into something that we didn't ask for, and nobody helped us.
The battle for New York is almost over, but new flashpoints still appear on the US map.
Do I think we're going to get a second wave? I said, we're not even done with the first wave. I said, the first wave is still going.
And that means that there will definitely be new casualties.